Have you ever wondered how a doctor solves a mystery that's happening inside your own brain? Well, today we're going to go behind the scenes with the neurologic detective and see exactly how they crack some of the most complex cases in the entire human body.
So let's kick things off with a classic neurologic mystery. Imagine this. Someone walks in with a headache and weakness all down one side. The list of what could be causing that is massive. So where on earth does the detective even begin to look for clues?
Now, you'd probably think the first step is some super high-tech brain scan, right? Nope. Turns out, the entire investigation really boils down to answering two surprisingly simple, yet incredibly powerful questions. First up, where is the lesion? This is all about location, location, location. You've got to pinpoint the exact spot where the problem is. And only after they have a good idea of the location do they ask the second question, what is the lesion? This is about finding the cause. This where, then what approach, it's the absolute foundation of neurology.
Okay, so every good investigation has to start by gathering clues. And in neurology, these clues come in two very, very distinct forms. You've got symptoms and you've got signs.
Understanding the difference here is absolutely crucial. A symptom is the patient's own story. It's totally subjective, like saying, I have a headache. But a sign is objective evidence that the doctor finds, something like a hyperactive reflex. So think of it this way. One is like witness testimony, and the other is hard physical evidence. And sometimes that witness testimony is the single most important clue you can get. This exact quote from a patient's wife, it immediately pointed doctors toward a life-threatening brain hemorrhage. And this was all before a single scan was even taken.
So with those first clues in hand, we circle right back to that first big question. Where is the problem? It is time to map the crime scene inside the nervous system.
So how do they actually map this crime scene? Well, they use this fascinating quirk in our body's wiring called decussation. Really, all this means is that the nerve pathways from the right side of your body cross over to the left side of your brain, and vice versa. It's like the whole system is intentionally cross-wired. And for a neurologic detective, knowing exactly where those wires cross is the master key to finding the problem.
Let's just look at a couple of these major pathways. So, you have the pyramidal tract. That's the system that controls all your voluntary movements, like waving your hand. Its wires cross over from one side to the other way up high in a part of the brain called the brainstem.
And it's pretty much the same story for the dorsal column, which is what lets you feel vibrations and know where your arms and legs are without even looking. Its wires also cross over at that same high-up point in the brainstem.
And here it is. This is the master clue. The pathway for pain and temperature, the spinothalamic tract, does something totally different. It crosses over almost immediately, way, way down low in the spinal cord. And this difference is everything. See, by testing movement, sensation, and pain on both sides of the body, a neurologist can figure out if the problem is above or below these crossing points. And just like that, they narrow the location down from the entire nervous system to one tiny little segment.
All right, so now the detective has a location. The investigation immediately shifts from where to what. It's time to identify the actual culprit. And here's the real secret. The single most important piece of evidence for figuring out the cause isn't about anatomy at all. It's about time, the time course of the illness, how the symptoms developed over time. That reveals the disease's unique signature, its MO. So for example, if a problem appears just out of the blue, we're talking over minutes or hours, and then just stays put, that's the classic calling card of a vascular event, something like a stroke.
What about a subacute progression? Where things just get steadily worse over weeks to months. Well, that points to something that's slowly expanding and taking up space, which is often the pattern you see with a brain tumor. Then you have a relapsing remitting pattern, so bouts of problems that last for days or weeks and then seem to get better. That is the hallmark of an inflammatory condition like multiple sclerosis.
And what about a very slow, gradual decline that unfolds over many, many years? Well, that strongly suggests a neurodegenerative process like Alzheimer's or Parkinson's. You see, each disease has its own unique fingerprint in time.
It's only after forming a really strong hypothesis based on the location and the timing that the neurologic detective finally turns to technology, like an MRI, to corroborate all the evidence. And this next part just brilliantly illustrates why that clinical work has to come first. Take the case of an accountant with just debilitating back pain and leg weakness. So they sent him for an MRI of his lower back, and the result came back completely normal. But the neurologist, based on his physical exam, just knew the problem had to be higher up in the mid-back area. He actually insisted on a second targeted scan of that specific spot. And what did they find? The real culprit, a tumor compressing the spinal cord. The detective work overruled the initial scan and, well, it saved the day.
And this is so important to get. Technology is an amazing tool, but it is not the detective. A scan might show 5 different abnormalities, but 4 of them could be totally harmless, kind of like gray hairs on the brain. It's only the clinician, guided by all that initial detective work, who knows which piece of evidence actually solves the case.
But after all of this brilliant detective work, after the entire puzzle has been solved, the job is still only half done, because beyond the case, there is always the patient. Think about a truck driver who was getting lost all the time and bumping into things. The neurologic investigation correctly diagnosed that his known cancer had unfortunately spread to his brain. So the where was the right hemisphere. The what was a metastasis. Case solved.
But for that patient and his wife, the questions were really just beginning. Will I have pain? Will I be able to recognize my children? The ultimate role of the neurologic detective, you see, isn't just to find the lesion. It's to care for the person, to shift from diagnosis to discussion, and to answer those profound human questions that truly matter the most.